Okay, let's unpack this. Imagine looking at your horse's urine and, well, seeing a color that's just not right. Red, reddish brown, maybe even black. It's definitely an alarming sight. But what does it actually mean? Is it blood? Is it something else entirely?
Yeah, what's fascinating here is that while the symptom, the discolored urine might seem pretty straightforward, the underlying causes are incredibly diverse, and figuring out which one it is, that's not just important, it's absolutely critical for, well, effective treatment and the horse's prognosis.
Exactly. So today we're doing a deep dive into equine pigmenturia. We've sifted through quite a stack of sources, things like equine pigmenturia, diagnosis and treatment, and another on hematuria, hemoglobinuria, and myoglobinuria. We want to bring you the essential insights. Our mission really is to arm you with the knowledge to understand what those, unusual colors could be signaling in your horse and how vets actually pinpoint the exact issue. So let's start at the beginning. What exactly is pigmenturia? What are we talking about?
Right. So simply put, pigmenturia just means there's an abnormal discoloration of the horse's urine because certain pigments are present. And for horses, there are really three main clinically significant forms we're focusing on today. That's hematuria, hemoglobinuria, and myoglobinuria. The tricky part, and what's critical to remember, is that all three can make the urine look very similar. Red, reddish brown, sometimes even dark brown to black. And that visual overlap, that's precisely why telling them apart is so crucial for getting the diagnosis right.
Okay, here's where it gets really interesting then. If they can all look so similar, how on earth do you actually tell these three apart? It turns out a surprisingly simple process can be, well, incredibly revealing right there, maybe even barnside in some cases.
Indeed. The core diagnostic approach often starts with something called the practical differentiation tip. First step, you collect a fresh urine sample. Then you centrifuge that urine. Basically, you spin it down at a very high speed in a machine. Okay, so if, after you spin it, a clear red sediment forms at the bottom, settles out from the liquid above, which should be clear, then you're looking at hematuria. That means there were intact red blood cells in the urine, and spinning just pulled them down to the bottom.
Okay, makes sense. What if it doesn't do that?
Right. So if the supernatant, that's the liquid above any sediment, if that stays red or brown, the next step is crucial. You centrifuge a blood sample taken from the horse. And here's the key. If the plasma, that's the clear fluid part of the blood that separates from the red cells when you spin it, if that plasma is red, pink, or even reddish brown, then it's hemoglobinuria. That color tells you there's free hemoglobin released from ruptured red blood cells actually circulating in the bloodstream and staining the plasma.
Okay, so the color's in the blood fluid itself.
Exactly. Now, the final scenario. If that blood plasma is clear, looks completely normal, even though the urine is still discolored, then you're dealing with myoglobinuria. And the reason myoglobin doesn't color the plasma, unlike hemoglobin, is because it's a smaller molecule. The kidneys clear it out of the bloodstream really rapidly.
Okay.
So it just doesn't build up in the plasma enough to change its color, even when there might be a lot of it showing up in the urine.
And I think it's really vital to remember you mentioned that all three of these conditions will actually show a positive result for blood or heme on a standard urinalysis dipstick, right?
That's correct.
So that just underscores why those centrifugation steps you just described are so absolutely vital. The dipstick alone won't tell you which pigment is causing the color. It just flags that something heme-related is there.
Precisely. It can't differentiate between intact cells, free hemoglobin, or myoglobin. So moving on to hematuria specifically, this is defined as the presence of actual intact red blood cells in the urine. That's what gives it that red, reddish-brown, or sometimes kind of smoky look. Fundamentally, it points towards bleeding somewhere within the urinary tract itself. So that could be the kidneys, the ureters, those are the tubes leading to the bladder itself, or the urethra. Or sometimes it might be contamination, particularly in mares, from the reproductive tract bleeding.
Okay, so actual bleeding inside the system.
Yes. And the key differentiating features we look for are that distinct red sediment after spinning the urine, blood plasma that stays clear, and then if you look under a microscope, you'll actually see numerous intact red blood cells down in that sediment.
Gotcha. And what usually causes this?
Well, when we talk about the causes of hematuria, probably the most common one we see in horses is urolithiasis. That's basically urinary stones or calculi. These stones can form in the bladder or sometimes elsewhere, and they just irritate and scrape the lining. You might notice the bleeding seems worse right at the end of urination, maybe particularly after exercise. Often it comes with other signs like straining, trying to pee frequently, or even showing colic-like pain. And this issue, urolithiasis, it's definitely more common in geldings.
Interesting. Are there other common causes?
Oh, absolutely. Other common things include urethral rents or lacerations. These are tears in the lining of the urethra. Again, you often see blood right at the end of urination, and it's something frequently seen in geldings and stallions. In stallions, it can actually cause blood in the semen, which we call hemospermia. Then you've got cystitis or urethritis. These are bacterial infections causing inflammation of the bladder or urethra. Signs that are usually painful urination, frequent attempts, but maybe only small amounts of urine passed. Less common, but potentially more serious, are various kidney diseases, things like infections spreading up to the kidney, what we call pyelonephritis, or immune issues affecting the kidney filters, or even kidney tumors. There's also a specific condition called idiopathic renal hematuria, or IRH. It's basically unexplained bleeding directly from one or both kidneys, and interestingly, it seems to be more common in Arabians and part Arabians. And then you have things like toxins and SCO2 overuse causing kidney damage, or blister beetle poisoning, even bladder tumors, direct trauma to the abdomen or pelvis, and actually even just intense exercise can sometimes cause microscopic hematuria just from increased blood pressure. But you can get visible bleeding if the bladder wall gets sort of bruised against the pelvis, especially if the horse exercises with an empty bladder.
Wow, quite a list. So if an owner suspects hematuria, what's the diagnostic approach a vet would typically take beyond that initial urine spin you mentioned?
Right, so beyond the urinalysis showing the red sediment and the red blood cells under the microscope, a physical exam is key. That includes a rectal palpation, where the vet can sometimes feel stones or masses within the bladder, especially in males. But really, the gold standard for actually seeing lesions inside the urethra or bladder is urethral endoscopy, which is also called cystoscopy.
Ah, putting a camera in.
Exactly. It lets the vet look directly inside and see exactly where the bleeding might be coming from. Is it a stone, a tear, a tumor, inflammation? Abdominal or renal ultrasonography is also really useful for looking at the kidneys themselves, assessing the bladder walls, checking for tumors that maybe couldn't be felt. And of course, blood work, like a CBC, helps check if the horse is becoming anemic from the blood loss. And a urine culture is almost always done if an infection like cystitis is suspected.
And treatment follows the cause, I assume?
Precisely. Treatment depends entirely on what's found. For stones, urolithiasis, surgery to remove them is usually the way to go in horses, as trying to dissolve them medically rarely works. For urethral rents, rest is really important, and sometimes vets perform a temporary surgery to divert the urine flow away from the tear to allow it to heal. Infections, cystitis, urethritis, those get treated with appropriate antibiotics based on the culture results. Kidney disease or tumors, well, those are often much more challenging and require supportive care tailored to the specific problem. Prognosis varies a lot. Tumors are generally poor, but some urethral issues can heal quite well.
Okay, let's shift gears then to hemoglobinuria. What's the story there?
All right, so hemoglobinuria. This is the presence of free hemoglobin in the urine, and it results from severe intravascular hemolysis. That's a key term. It means red blood cell destruction is happening within the bloodstream itself, not just leaking out intact. So the urine will look red, reddish-brown, or maybe dark brown, even black. But crucially, and this is the big difference, the horse's plasma will also be visibly discolored. It'll be pink, red, or reddish-brown. That's because the free hemoglobin released from all those bursting red cells is circulating in the blood, staining the plasma. We call that hemoglobinemia.
Wow, okay, so the blood fluid itself is actually pink or red. That's a major clue.
It's the major clue for this one. So the key differentiating features for hemoglobinuria are that urine supernatant stays red or brown after you spin it, but there are few, if any, intact red blood cells when you look microscopically. And, as we emphasized, that blood plasma will be visibly discolored. The dipstick, remember, will still show positive for blood because hemoglobin contains hemin, just like intact red cells.
So what causes this widespread bursting of red blood cells? Sounds pretty serious.
It is very serious, often life-threatening. The causes of intravascular hemolysis can be quite dramatic. Probably the most common and often devastating cause we see is red maple toxicity. That's from the Acer rubrum tree. Specifically, it's ingesting the wilted or dried red maple leaves that causes severe oxidative damage to the red blood cells, making them rupture massively.
Red maple leaves. Wow, okay.
What else? Other significant causes include neonatal isoerythrolysis, or NI, in newborn foals. That's where antibodies the foal gets from theirs colostrum actually attack and destroy the foal's own red blood cells. It's an immune reaction.
Oh, right. Heard of that.
Yeah. We can also see it with certain phenothiazine toxicity. maybe from some tranquilizers if given at really high doses,
Hmm.
or even onion or garlic toxicity if a horse somehow eats a large amount. Less common, but still serious, is immune-mediated hemolytic anemia, or IMHA. That's where the horse's own immune system mistakenly attacks its own red blood cells. Certain infectious diseases like equine infectious anemia, EIA, the one needing the Coggins test, and babesiosis, which is a protozoal infection, can also cause hemolysis. And then there are rarer things like copper toxicity, weirdly, drinking excessive amounts of water very quickly, severe reactions to blood transfusions, or even consequences of severe burns or heat stroke.
That really does sound incredibly serious. How do vets diagnose this, and what's the most urgent thing to do if it's suspected?
Diagnosing hemoglobinuria relies heavily on those key findings. The urinalysis showing the colored supernatant with few or no red cells, and that critical blood work. The blood work will show anemia, often severe, that characteristic pink or red plasma confirming hemoglobinuria, and usually elevated bilirubin levels, which can make the horse look jaundiced or icteric. Vets will also often look for something called Heinz bodies on a blood smear. These are little clumps visible inside the red blood cells that indicate oxidative damage, which is common with things like red maple toxicity. And then specific tests might be run if a particular cause is suspected, like the Coggins test for EIA or antibody tests for babesia.
And treatment, what's the priority?
The absolute immediate priority is removing the horse from the cause, if you can identify it, like getting them away from red maple leaves immediately. And then aggressive intravenous fluid therapy is absolutely crucial. This is non-negotiable.
Why are the fluids so critical here?
Because that free hemoglobin circulating in the blood is actually really toxic to the kidneys. It can precipitate, basically clump up in the tiny tubules inside the kidneys and cause acute kidney failure. Aggressive fluids help flush the kidneys, dilute the hemoglobin, and try to prevent that severe damage.
Okay, that makes sense. Fluids first.
Fluids first, yes. Then blood transfusions might be necessary if the anemia is life-threateningly severe. Oxygen therapy can help if the horse is having trouble breathing because of the lack of red cells carrying oxygen. And sometimes there are specific antidotes. For example, methylene blue can be used for severe methemoglobinemia, which is a specific blood problem often caused by red maple toxicity where the hemoglobin can't carry oxygen properly. That can be life-saving. And for immune-mediated cases, like IMHA, treatment involves using drugs to suppress the immune system. And actually, if we connect this to the bigger picture for a second, both free hemoglobin, which we just discussed, and myoglobin, which we'll get to next, are highly toxic to those renal tubules when they're present in high concentrations. This just underscores the critical need for rapid and aggressive fluid therapy in both hemoglobinuria and myoglobinuria cases. It's often the very first, most crucial step to try and protect those kidneys from severe, potentially irreversible damage, really regardless of the exact underlying cause.
That's a really important connection. Okay, so that brings us to the third one, myoglobinuria.
Exactly. So myoglobinuria, this is the presence of myoglobin in the urine. Myoglobin is a protein that's released from damaged muscle cells. So this condition is a direct result of severe muscle damage, what vets call rhabdomyolysis, or what horse people commonly call tying up. The urine here also appears reddish-brown to dark brown or black, but, and here's the unique identifier, the horse's plasma remains clear and normal colored.
Ah, so the urine is dark, but the blood plasma looks fine. That's the key for this one.
That's the absolute key. So differentiating features. Urine supernatant stays discolored after spinning, but the blood plasma is clear. Microscopically, again, you'll find few to no actual red blood cells in the urine sediment. And just like the others, the dipstick will still test positive for blood because myoglobin also contains that heme group.
Okay, so this is the tying up one, essentially. What causes that severe muscle damage?
Right. It's directly linked to significant muscle breakdown, or rhabdomyolysis. The most common cause is exertional rhabdomyolysis, which is the classic tying up. Now, this can be sporadic. Maybe a horse has exercised way beyond its fitness level, or there's a sudden diet change to high-starch feed, or the horse gets dehydrated during exercise. But there are also chronic, often inherited forms, things like recurrent exertional rhabdomyolysis, or RER, which we see more commonly in thoroughbreds and related breeds, and polysaccharide storage myopathy, PSSM, which comes in type 1 and type 2 forms. PSSM is quite common in breeds like quarter horses, draft breeds, and many warm bloods. These horses have underlying issues with how their muscles handle energy.
So genetic factors can play a big role in tying up.
A huge role in the chronic cases, yes, but there are other causes of severe muscle damage too. Another really serious one is atypical myopathy, sometimes called pasture myopathy. This isn't related to exercise. It's caused by ingesting a toxin called hypoglycin A. This toxin is found in the seeds or seedlings of certain acer species, notably the box elder maple here in North America or the sycamore maple over in Europe. So another maple causing problems, but a different mechanism and different tree part.
Wow, maples again. Different type, different problem.
Exactly. Then you can have toxic myopathy from other things. A big one is accidental ingestion of ionophores like monotin. These are common additives in cattle feed, but are incredibly toxic to horses, causing severe muscle and heart damage. Certain plants can also be myotoxic, and even blister beetle toxicosis, which we mentioned under hematuria, can also cause muscle damage. Traumatic myopathy is another one, like from severe crush injuries. Or if a horse is down and unable to get up for a long time, the pressure causes muscle damage. And finally, there's nutritional myodegeneration, better known as white muscle disease. This is caused by a severe deficiency in selenium and/or vitamin E, and we typically see it in young, growing foals.
Okay, so quite a range there too, from genetics to toxins to nutrition. Given all that, how do vets pinpoint the specific reason behind the myoglobinuria?
Well, the diagnosis starts with that urinalysis showing the colored supernatant and, crucially, the blood work. The blood test is critical here because it will show markedly elevated levels of CK, which is creatine kinase, and AST, aspartate aminotransferase. These are specific enzymes that leak out of damaged muscle cells into the bloodstream. Seeing those sky-high levels confirms significant muscle damage. And crucially, as we keep saying, the plasma color will be normal, ruling out hemoglobinuria.
Right, the enzyme levels are the big flag here.
Yes, along with the clear plasma. Then, a thorough history is absolutely vital. When did it happen? What was the horse doing? Any changes in feed? What's the pasture situation like? All crucial clues. A physical exam is also important, checking for muscle stiffness, pain on palpation, maybe tremors, or just a general reluctance to move, classic signs of tying up. And for those suspected chronic inherited forms like PSSM or RER, specific genetic tests are available now, usually done from a hair or a blood sample.
And the treatment approach. Sounds like fluids might be important again.
Absolutely. Treatment, much like with hemoglobinuria, starts with immediate removal from the cause, if possible. So stop exercise immediately if it's exertional, change the feed if that's suspect, get the horse off the pasture if atypical myopathy is suspected. And yes, aggressive 5E fluid therapy is absolutely crucial here too, for the same reason as with hemoglobin, to prevent acute kidney injury. Myoglobin is also toxic to the kidney tubules and can cause them to shut down.
Okay, flush those kidneys again.
Flush those kidneys. Pain management is also key, usually with NSAIDs like bute or banamine, and sometimes muscle relaxants. Correcting any electrolyte imbalances found on blood work is important too. And then providing supportive care, like stall rest initially, careful reintroduction of movement, dietary management long-term for the chronic cases. That's all part of it.
So, wrapping this section up, what does this all mean for you, the horse owner listening? It seems the spectrum of pigmenturia is really wide, and the signs can vary hugely depending on what's actually causing it. But hopefully, you now have a clearer framework to understand what might be going on and, importantly, what questions to ask your vet.
That's right. And maybe it's worth briefly touching on just a couple of other things that might look like pigmenturia but aren't quite the same, other differential diagnoses we call them. For instance, sometimes you might see blood accumulating near the vulva in pregnant mares. That could be from varicose veins in the vagina bursting, not necessarily from the urinary tract itself.
Ah, okay.
Then there's something we call factitious pigmenturia. That's where the urine just appears dark. Maybe it's super concentrated because the horse hasn't drunk much, or sometimes natural substances in horse urine called porphyrins can oxidize after the urine is passed, especially on snow or light-colored shavings, making it look reddish or brown, even though it was normal when it came out.
Right, I think I've seen that happen on shavings before.
Yeah, it can be alarming, but it's harmless. And even certain medications can change urine color, like the antibiotic Revlimid can turn it orange, or another antibiotic, doxycycline, can sometimes make it look dark brown or black. So always good to consider medications too.
Good point.
But really, this all just reiterates that prompt veterinary intervention is essential in all cases where you see discolored urine. You need to know what you're dealing with. Identifying the specific pigment is red cells, hemoglobin, or myoglobin. And then figuring out the underlying cause is paramount. And as we've stressed, it can be a race against time, especially with hemoglobinuria and myoglobinuria, because that risk of rapid kidney damage is so significant. Knowing which pigment is involved is what dictates the most effective treatment strategy and gives you the most accurate idea of the prognosis.
Wow. What an incredibly detailed journey through, such a specific but really vital area of equine health. It truly highlights how even a seemingly simple observation like urine color can just open up this incredibly complex diagnostic puzzle. The key takeaway for me is really just how critical that simple centrifugation step can be right at the start in pointing the investigation in the right direction among these potentially very serious conditions.
Absolutely, and maybe this raises an important question for everyone listening. Given these subtle but really critical differences in diagnosis and treatment for each type of pigmenturia, what other seemingly small observations might you be overlooking in your horse's daily life? Those little things that might actually be signaling a significant underlying issue that needs attention.
That is a perfect thought to leave everyone with. This deep dive really shows us that paying close attention to every detail, no matter how small it seems, is such a powerful tool for being a well-informed and proactive caretaker for our animals. Thank you so much for joining us on the deep dive.